Welcome to Teaching. I'm Silas Fincher, and in this video we will discuss the ADHD child. More specifically, we will look at the perception of the ADHD student. We will provide you information on the diagnosis and disorder of ADHD, and we will give you strategies to help you teach this special student population. Students with ADHD are perceived by their teachers and peers in very distinct ways. Let's hear from some teachers on how these students can be labeled in the classroom.
This is going to be a challenge. This is going to be, in order for this child to help this child to reach their potential and to be a successful learner, that it is a challenge that the teacher must overcome. A lot of teachers I think, have a negative outlook on when they see that label.
Perception by peers and teachers can really put an ADHD student at a disadvantage from the get-go. It's important that we as educators truly understand the disorder and diagnosis to help these children grow.
ADD is attention deficit disorder, and that is when a child has trouble focusing and completing work and staying on task as far as a student who goes from being a student. And ADHD is attention deficit hyperactivity disorder, which the students have the same trouble of focusing and keeping their attention, but they have the hyperactivity along with it. So, you might see things like having trouble sitting still, fidgeting, making noises, things like that.
In high school, okay, if there is a student that's having difficulty in like the majority of his classes, the teachers may go to the counselor, or the parent of the student may go to the counselor and say, my son or daughter is having trouble with learning. Look at the grades, look at some of maybe their behavioral concerns as well. And the parent has noticed the behaviors, they've noticed the grades as well as the teachers, and then they refer that student to the referral to the exceptional children's. If the counselor warrants there's a need to go ahead and see if the student needs help, they may go to, first they do interventions. So they take all the teachers and they say, let's go ahead and monitor how he's doing on homework. Let's go ahead and change the seating of the child and see if that helps. So they go through an intervention process and gather information. At the end of that gathering it's probably about 6 weeks time, then they go ahead and determine, that committee, that team determines whether maybe just a 504, okay, would be sufficient. So looking at the just the modifications that could be done in the classroom, and then by using the 504, then they could do better with their grades and their academic performance. But also at that same time, they may warrant the need to see if the student qualifies to receive special education. Then they go through a process of vision, a hearing. They do an educational. They may ask for information from the doctor, the physician's form, and where they would take the daughter or son and see what characteristics the physician notices at that time. And a lot of times it is the physician that notices like the ADD, ADHD, tiring, the vitality, and things like that on the physician's form. Okay, at the conclusion of all that, that they do, and there's a whole list of things that they do with the evaluation. The team gets back together, and then at that time, either the child does qualify for special education, or the thing is that they don't. If they qualify for special education, then the IEP is written, and that's just showing the strengths and the weaknesses of the child and kind of looking down the road the next couple of years as to what's going on. But also at that time, if the child does not qualify for special education, a 504 can be written. An IEP is a individualized educational program, and that is written or developed by a team, the IEP team, once a student becomes certified as an exceptional student.
ADHD students see things differently, and some would argue they see things better. Let's take a look at Dr. Charles Hutchinson's ADHD model and how it relates to the classroom. Dr. Hutchinson's ADHD model describes the differences between average students and students with ADHD in the classroom. An average student might get 10 units of incoming information, and multiplying that by the 10 bits of previous information would receive 100 new ideas per classroom. Of that is probably 10 useful or interesting ideas per class. However, with an ADHD child, more units of information are being broadcasted. So with this model, about 20 units of information are being brought in, 10 units of previous information are there, which would create twice as many new ideas, or 200 new ideas per classroom. Of these, probably 20 useful or interesting ideas are being brought for the class. This right here creates an information overload, and the student is not able to decipher which pieces of information are important or not important. This model helps teachers to understand more about how the brain of an ADHD child works. Understanding this model can help you see the advantages and challenges students with ADHD face in a classroom environment. Let's hear about some instructional strategies that might help you and your students.
Well, first I think about the physical environment. So I think about where is this child sitting. On the carpet area, when I'm doing whole group reading or activities, sit them at the front. And the same thing with their desk. They need to be facing me and not facing away. And also, who are they around? Once I get to know the students, are they next to someone who's going to be even more of a distraction? So also thinking about who they're sitting by. When it comes to work, sometimes it's not giving them as many problems, giving them enough to assess their knowledge, but not overwhelming them with the amount of problems they have to do. So it could be, like in math, 5 problems as opposed to 10 that everyone else is doing. Giving them more time. A lot of children with ADHD, since they have trouble staying focused and keeping their attention on their work, giving them a little extra time. When I'm giving directions, a lot of times I will give one at a time to that student. Or if it's something we do regularly, that they have a checklist with visual pictures on their desk to help remind them of what they need to do, like unpacking in the morning. And I know that I'm going to have to tell that student 3 times and not just 1 time, and they never will get it just 1 time. So giving them several reminders. I always give tips. I say these, I always say, these are what I do at home, here at school. Is there anything that you do at home that helps motivate? Because a lot of time rewarding and having a behavior plan to help motivate that student and accommodate to that student's hyperactivity is what I have to do. So.
You want them to be able to interact as much as possible, so you don't want long periods of instruction without interaction, but just perhaps them listening. You can use proximity control. The teacher could be somewhat, when they walk the path in the classroom, they can call on the student as well, always posing the question, and then calling on the student, wait till I'm there.
And make sure that there are breaks in between. There's never a long period of sitting. A long period of at their seat work, that they have a break to get up and move around, or any activity I do, I try to incorporate movement into the activity so that they're not sitting for a long period. A lot of the more intensive things like reading and math are in the morning, so they're not as worn out, because as the day wears on, their attention gets shorter.
Besides breaks up the instructional periods, is in tune with the student and actually gets out the whiteboards or gets out the markers or asks a student to come up to the Promethean board. You're engaging the students, and again, I think that the amount of engagement and the amount of interaction is very important in a classroom with ADHD students.
Scientists are still learning about ADHD and how it affects the mind. As this research develops, newer, more effective strategies are being introduced. Remember, ADHD students can learn as well as their peers, and it's up to us as educators to find the ways to make all our students successful.
To know that you're really helping that child overcome something that's hard for them.
Thank you for watching. We hope that this video helped you to understand more about how ADHD students work, their challenges, and the ways to make them successful in your classroom. Good luck!